Hello and welcome to this recording of the first webinar in the Welcome Back series produced by the Early Years Alliance. My name is Michael Freeston. I am Director of Quality Improvement at the Alliance, and I'm joined by Melanie Pilcher, who is our Quality and Standards Manager.
Hello everybody.
If I can just talk you through the aims of the session, it is to review the government's guidance relating to the planned opening of early years provision to all preschool age children from the 1st of June, to consider the implications of the planned opening up of provision for setting managers, practitioners and childminders, and to introduce the range of resources the Early Years Alliance has produced to support the sector as it opens up, of which this webinar is one. More of that as we go through today's session.
Michael, this might be a good time to mention as well that although today's presentation is really useful for childminders, we are also hosting a separate childminder webinar in the near future.
It will be in next week, which from my calculation is Monday the 18th, and further information will be available through our social media channels. Thank you, Melanie. The format of today's session is we will have received questions through attendees, and we will try and weave these into the presentation as we work forward. But understandably, it may not be possible to answer specific questions relating to an individual's circumstances, or the sheer volume means that it may not be possible to address all in this webinar. So what we will do is address all question topics that are raised through the Alliance's Q&A section on its website under the providers section, if you search for that. This is a very fluid and developing situation we have at the moment, with further guidance expected from the DFE, Cabinet Office, etc. So it is important to keep popping back to the website to try and keep up to date with the evolving picture, whether that's in terms of good practice guidance or funding situations, etc. We do dedicate a team to this to try and make sure we can get up to date, relevant information to you as quickly as possible. The materials for today's sessions are drawn from a number of sources. Most importantly are the various government guidance publications that have been produced since the Prime Minister's speech on Sunday of this week, which started to outline the roadmap for bringing the country out of lockdown. If you are not already signed up to the DFE's daily update service, I can strongly recommend that you do sign up. It's very easy to do off their website, dfe.gov.uk, and you will receive directly into your inbox daily updates on DFE's progress and any updates that come along. What we have tried to do is fillet the information that came from a number of documents for today, but that is no substitute for reading them yourselves to actually think through the implications for my setting, my provision, etc. As well as the government's Rebuild the UK COVID recovery strategy, there is a specific document, the second one listed there, which refers to education and childcare settings to prepare for the wider opening on the 1st of June. And also embedded within that document is a more specific one in terms of protective measures in education and childcare settings, and we will try and look at those as we go through today. As well as the formal documents, we will be drawing on the experiences and advice from providers who have remained open during the first 7 weeks of the lockdown, and drawing on the creative ways they've approached provision in these difficult times, and participant comments that have been raised with us either before today's session or as things arise as they come through. What we won't do, what we're not able to do, is to give you the definitive, this is what you must do for your provision by the 1st of June, for an opening, because fundamentally those answers do not exist. This is an unprecedented situation we all face, and we are having to be creative in terms of considering what the guidance, what the circumstances, what my community I have to bear in mind when it looks as though I am opening my provision. What I'm always proud of is how this sector rises to any challenge that is presented and considers creative ways of addressing issues, parental anxieties, anything that may arise. So I have absolute confidence that the sector can look to open up its provision and to welcome children back in a way that will be safe and very supportive from a child's perspective and support their learning and development. The first slide to which I'll draw your attention is taken from the roadmap to recovery. And I've highlighted some points there because in a sense we could spend the entire 45 minutes of this webinar on this one paragraph. There is a recognition that demand for childcare is likely to be lower than usual at first from the week commencing the 1st of June. And just a point on this, we had the question, do I have to open on the 1st of June? Absolutely not. This is a situation, and it will become apparent as Melanie talks us through the implications for the guidance for your provision. This is from the 1st of June. Consideration to when you reopen is very much down to your consideration of the circumstances you face. But there is a recognition on the part of government that actually demand for childcare may be lower, whether that's as a result of parental anxiety about letting their children back into provision, or whether they are not going back to work, so they feel as though they don't need childcare, etc. So one of the things we will talk about is how you have to discuss with your parents what their circumstances are and what their plans are. There is also a recognition that the physical layout of a setting does not allow small groups of children to be kept a safe distance apart. We expect practitioners to exercise judgment in ensuring the highest standards of safety are maintained, obviously, and Melanie will talk through that. And also implied there is the potential for a temporary cap on numbers to ensure that safety is prioritised. There's also the reference there to childminders from the 1st of June. You may also be aware that from Wednesday of this week, so the 13th, I think that was, childminders have been able to open to children from the same household if they're not already caring for vulnerable children or children of key workers. And as Melanie said, we will be doing a childminder specific webinar in the week commencing the 18th of May. So please look out for that one either live or as this event is recorded and placed on our YouTube page. I think it's important to understand why government is so keen for education provision to restart. And in the following paragraph, which I'll just read, the explanation is this. We want to get all children and young people back into education as soon as the scientific advice allows, because it is the best place for them to learn, and because we know how important it is for their mental well-being to have social interactions with their peers, carers, and teachers. So I think it is an important statement when you're having conversations with your parents who may be anxious about allowing their children back to your provision, to actually just have the discussion about, let's also look at the balancing situation of how important the social interaction that childcare provision can do for their mental well-being. And we will do everything we can to mitigate the risk of virus transfer, but let's also look at the risks of not going back. And building on that, within the same document, there is this statement which we've produced back here in terms of what is the latest science. And I think this is again important if you're having those conversations with parents, that actually there is evidence and high scientific confidence that younger children are less likely to become unwell if infected. There's also less chance that they are transmitters, etc. So whilst we're all understandably anxious at the moment, having informed conversations with parents about balancing the risks, concerns, I think will be an important discussion to have with them. Within the documentation around education and care, there are some interesting considerations. I won't go into these in too many details because Melanie will pick them up as in her section. There are a couple of points to which I wanted to draw particular attention, however, and the first is which children should be considered as coming back into your provision. And it's quite a complicated section in the guidance because it makes this distinction between children who are coming from households where there may be somebody who is clinically vulnerable and children who are coming from households where there is somebody who may be clinically extremely vulnerable. And the circumstances differ for both those groups. And the clinically extremely vulnerable are those who received, I think, Melanie, it was the 1.4 million letters from the Department of Health indicating that they should be shielded for 3 months.
That's correct, yes.
For children who are coming from clinically vulnerable households, the advice is this. A child, young person, or a member of staff, and I should stress this is for staff as well as children, who lives with someone who is clinically vulnerable, including those who are pregnant, can attend their education or childcare setting. So living in a house with somebody who is old, whether that's a grandparent or who has an underlying health condition, but is not considered as clinically extremely vulnerable, can come back into the setting. For those children who live in households where there is somebody who is clinically extremely vulnerable, the guidance is slightly different. And it's this: if a child, young person, or staff member lives in a household with someone who is extremely clinically vulnerable, as set out in the guidance, etc., it is advised that they only attend an education or childcare setting if stringent social distancing can be adhered to. And in the case of the children, if they are able to understand and follow those instructions. Now, clearly, from an early years perspective, we are not able to guarantee social distancing, and also the recognition that children may not be fully able to understand and process the requirements for social distancing. So by implication, if children or staff members are in a household with where somebody is clinically extremely vulnerable, they should not attend an early years setting. Melanie will talk more about that as we go through. The other point there is that if a member of staff or a child is symptomatic or self-isolating, they should not attend either. The other point that I will just draw attention to is consideration of class sizes and staff availability. And it's important that this has been recognised by DFE that preschool children cannot be expected to stay 2 meters apart. The main approach to fighting this virus for the population as a whole is the social distancing of keeping people apart. There is a recognition, however, that for preschool children, that is not possible. So all of the advice that we want you to give consideration to is, okay, we can't do social distancing. How do we therefore mitigate the risk of transmission through hygiene engagements, other activities, etc.? And that will be the focus of what Melanie looks at. The other points that you should give consideration to, as outlined in the guidance, are issues of staff workload and well-being. Again, we'll talk about that. How you get children to and from your setting, provision of food, and group sizes. These are all the points that are in the guidance, and these are the circumstances that to which you need to give consideration from your settings perspective. And just before I hand over to Melanie, the second document, these bullet points are taken from the specific document around implementing protective measures in childcare and education settings. And not surprisingly, many of the questions that get raised with the Alliance is, what is the situation with PPE, the use of PPE and face coverings in early years settings? I thought it helpful to just read what it says around PPE in education. Wearing a face covering or face mask in schools or other education settings is not recommended. Face coverings may be beneficial for short periods indoors where there is a risk of close social contact with people you do not usually meet and where social distancing and other measures cannot be maintained, for example, on public transport or in some shops. This does not apply to schools or other education settings. School and other education or childcare settings should therefore not require staff and learners to wear face covering. The majority of staff in education settings will not require PPE beyond what they would normally need for their work, even if they are not always able to maintain a distance of 2 meters. PPE is only needed in a very small number of cases, including children, young people, and students whose care routinely already involves the use of PPE due to their intimate care needs. So from an early years perspective, clearly nappy changing would be one of these situations, and you should give consideration to that. Also, if a child or young person or the learner becomes unwell with symptoms of coronavirus while in their setting and needs direct personal care until they can return home. In this situation, a face mask should be worn by the supervising adult if a distance of 2 meters cannot be maintained. If contact with the child or young person is necessary, then gloves, an apron, and a face mask should be worn. So, circumstances, the guidance as it currently stands is that PPE should not be used routinely in an education setting. But I'm sure you may have seen coverage on the news or anywhere in terms of early years provision that has opened up in other parts of the world where there has been some face covering used at exchange times when parents are dropping off, etc. And you may wish to give consideration to that, and I'm sure Melanie will raise that as we move forward. The other points that are on the slide there are the other issues to which you should be giving consideration as you are planning to reopen. So considering what you do in terms of timetabling, staggering drop-offs, how you interact with parents at those times, grouping of children, the use of play equipment, and also the interesting one at the bottom is removing soft furnishing to soft toys and toys that are hard to clean. Again, that's a real challenge in early years provision. Certainly the soft furnishings for childminders is a particular consideration, but obviously children's favourite toys, etc. So they're all the easy questions that I'm going to pass over to Melanie.
Thank you, Michael. Okay, so inevitably, after reading the guidance, we are, of course, left with more questions than answers. And of course, what we all want is clarity. What we all want to know is exactly what we need to do next. But one size does not fit all, and every setting is unique, as we well know. It's one of the joys of the provision we're able to offer for parents and give them choice. But actually, at times like this, it's one of the things that poses the greatest challenge to us. So the onus is definitely on you to do what is both right and what is possible for your provision. So that's why I wanted to start by talking about the terminology that's used in the guidance and what that actually means for us. In the disapplications and modifications to the EYFS that were brought in earlier this month, we see the term reasonable endeavours being used. For example, using reasonable endeavours to meet the learning and development requirements. And I'll just say quickly that those disapplications and modifications are being reviewed monthly by the DFE, but as it stands at the moment, those will be in place until I believe it's the 25th of September, but certainly towards the end of September. Then we see terms like we should be working towards and taking steps towards. And again, that reminds us that we're not all expected to open on the 1st of June, nor are you all expected to get back to normal within weeks. It is going to take time, and all we can do is work towards that. There will be challenges along the way. We will make mistakes inevitably because we don't know. There are more, like I said earlier, there are more questions than answers. But if we're taking steps towards getting back to normal, it's what we need to do. And that risk assessment approach that I will keep coming back to is what's going to help us do that in the safest way for our children, for the staff, and for the sector as a whole. There are very few musts used in the guidance documents, unless to reiterate that the existing statutory requirements for the EYFS remain. And all we can do, as it says at the bottom of the slide, if we keep the child at the heart of the decisions that we're making, it sometimes makes those decisions easier to make. You need to be viable, of course you do. It would be very naive to suggest that we can be idealistic at this time, because you need to be able to balance the number of children you can cater for with the number of staff that you've got available to do that. And we need to be able to justify or defend, if you like, the decisions that we're making as we go along. So thinking things through and being able to justify why you're doing what you're doing and what you're basing those decisions is really important. And also,
that's an interesting
yes.
phrase, Melanie. Defensible decision making. Defensible to whom when you were writing that slide?
I think in the first instance to yourself, to the families that you're providing care for, not so much the policymakers at this point in time, because they really don't know. They're trying to cater for all those decisions that you have to be able to make, and they're not being very specific. So I think in the first instance, we've got to be able to justify. Maybe defensible is the wrong word. Maybe justify is a better word.
No, I think it is. It's an interesting choice of phrase, and one that I quite understand, because the other thing to bear in mind is, remember, Ofsted have suspended inspections.
Yes.
So that issue of always being Ofsted ready may not be there, which is the principle to which we always try and adhere. But still, I think that's why defensible is a useful phrase, because it's defendable to ourselves and to our parents. Are we doing the right thing for the children, and have we made it as safe as possible for the children? Because Ofsted will not be coming to inspect for the foreseeable future.
No, absolutely, Michael. Although, of course, if concerns are raised about a setting, then Ofsted will still carry out an inspection, whether that be face-to-face, I'm not sure, but they still have that duty to ensure that settings are meeting those regulatory requirements whilst they're in place.
Yes, they will be. They have reserved the right to come in and inspect in those situations. So I should make that point clear.
Absolutely. And finally, to be bold, and again, you might question why I say that, but I think if we go through that decision-making process, we risk assess, we can justify or defend to ourselves why we've made those decisions, then the next step is to boldly go forward with them. And that's, again, a challenge, isn't it? Because you have to bring everybody with you, and that includes parents and, of course, the rest of your staff team.
Thank you.
So if we can just move on then. And quite rightly, before I say anything else, we will begin with the child. And Michael, this was a term that you used recently. You said,
I love it when you quote me, Melanie.
Oh, well, not very often. The children you said goodbye to in March are not the same children who will be returning. And when I first read that, I thought, well, of course they won't be. But actually, we need to really think about that, because, of course, these 7 weeks, 8 weeks, as we come towards the end of May and beginning of June, is a long time in a child's learning and development. And of course, they will all have had very unique experiences during that time, some positive, but of course, some more negative as well. And we have to consider the impact that will have had on children. And then there are practitioners in our teams, because they will have to be emotionally ready to come back to work as well. And some of those practitioners themselves will be different people to those that we said goodbye to 7 weeks ago. So all these things need to be considered, and we don't yet know how lockdown will have affected children. This is such a critical time in their development, as we all know, and so we've got to be tuned in to the individual child as and when we welcome them back in, so that we can respond again to their individual needs, putting their needs first. You mentioned earlier, Michael, about parents and how we need to have those discussions with parents as we prepare them to come back. We need to have that dialogue. We need to know what their concerns are. We need to know what their needs are. And we also need to be prepared to reassure them. And again, using science, that's one thing that we can use to actually support our case, so that we're not trying to make anybody do what they're not comfortable doing by sending their child back, but we want them to feel as confident as they can in what we're doing for their child.
Thank you. Just a practical example on that. I had some feedback from a manager who was saying that she had originally sent out a survey to parents, written to them. And for those that were returned, and there weren't many, people took a fairly negative tone in terms of, no, I don't think I will be. What was then subsequently followed up was actually a direct conversation through a telephone call. And actually there was a far more, both in terms of return rates, you reach more parents, but also in terms of their positive view of returning was different, actually having the conversation with somebody rather than just responding as invited to on a survey documentation. I think there's something interesting there in terms of the relational aspect between the manager and the parents, that humanizing it in some way may actually go a long way towards in taking a more positive view on the part of parents.
I totally agree with that, Michael. And we ourselves have produced a template for practitioners to send out to parents to actually find out a little bit more about their child's experiences during lockdown. And one of the things that we urge everybody to do is to make it clear to parents that they can talk to you, but the provider taking the initiative to actually phone parents as well, I think is a really good step forward. Okay, we can, thank you. The challenges. So the biggest challenge we have possibly for the sector, or one of the biggest challenges, is of course social distancing. And the measures that we're being asked to take, in particular social distancing, are actually all aimed at reducing the spread of infection. The DfE acknowledged that in an early years context, social distancing, as we understand it, keeping 2 meters apart, is nigh on impossible to achieve with young children. And I just have this awful image of people shouting, stop, stay put, don't move, put your arms in the air and don't move. And that's going to cause so many anxieties for children as well, that it just isn't going to happen. It's a really big concept for young children to grasp, and how you manage it is certainly going to impact on them. So that idea of it being a constant stopping children from doing things is just not very positive at all. So that puts the emphasis clearly back on how we reduce the spread of infection. And there are very positive things that we can do to that. Of course, we can socially distance manage parents that are dropping off and collecting children. And there are some things that we can move towards with social distancing. For example, how we actually group children. We'll talk a little bit more about that in a moment. So the focus is certainly on that advanced or enhanced infection control measures. And coming back to the small groups and the grouping of children, it's probably one of the things that we're getting most questions about. And this will depend so much on the layout of your setting and on the number of staff that you have available. So again, what I've done, rather than saying, well, you must do it like this because whatever instruction the government give or whatever advice we give, it's going to be different for you. So all I can do at this point is actually start to highlight some of the things that you need to think about. And if we can
one of the questions that got raised with me was in terms of the views on inviting children to change their clothing as they arrive in the setting. Can you just give some consideration to that, please?
Yes, it's a possibility, and I do think it is one of the things you could certainly look into. Maybe childminders might find that easier to manage as well. It would be a challenge because the more children that you have, the harder that's going to be to achieve. But we also know that for some age groups who maybe are used to going out and doing forest school sessions, children between 3 and 4 year olds are much more able to manage their needs and actually get themselves changed. It becomes part of the routine of the day for them. So it's certainly a possibility, thinking of having clothes that can be kept within the setting that children can change into, and those are sent home every other day. But again, this is about negotiating with parents as well about what is achievable and reasonable for them. But it's certainly one option. And I think the same goes for staff. It might be that staff can keep their tabards, their sweatshirts at work, leave them at work, change into them when they arrive at work, and then, you know, change again at the end of the day, so that nursery clothes are kept for nursery. And just as nurses used to wear capes, I'm old enough to remember when nurses used to wear capes so that their work clothes were not exposed to the outdoors environment and the risk of cross-infection.
Thank you.
I think I've baffled you with science there, possibly.
No, that's really helpful. It has got raised, and I've seen it in it was a recommendation from another part of the world, and I just thought I'd raise it here. Thank you.
Okay, so again, looking at the challenge, one of the things that struck me, and as Michael knows, I am a huge advocate for outdoors, and there are already, or had been already, provision cropping up all over the country who are more or less 100% outdoor provision. And so it just seemed to me that this is a good time to actually look at how you can make full use of the benefits of outdoor provision. It does help to minimise infection spread. We know that being outdoors is good for children's health and for their mental well-being as well. And at a time when this is critical, I would say now's the time to grab the bull by the horns. And if you've been thinking about increasing your outdoor provision, then go for it. It's one way that you can maximise the space that's available to you as well. And it might help with being able to organise those small groups. And of course, it promotes children's learning and development, because there's nothing that you can't do outdoors that you could do indoors, apart from perhaps shelter from the rain. But of course, not everybody has suitable outdoor space. So going back to that, you might just want to think about how you can utilise the space that you do have indoors, no matter how, outdoors, so no matter how small it is, but also think about how you can bring the indoors or the outdoors inside by making use of natural resources and materials, which again might go some way to compensate for some of the resources and materials that perhaps you will have to suspend during this time. And just wanted to flash this up on the screen because the Alliance has been working really hard on putting together resources to support you as you try to implement the guidance. And as I said before, we haven't got all the answers. We can't give you all the answers because they don't exist. One of the things we can do is to give you practical things like checklists, and this is just one example of them. This is the checklist for managers and leaders and committee members, of course, because they need to be involved in this process too, to think about as you get ready to bring staff back, as you get ready to open those doors. This is one of, I think, 5 pages in this checklist, and just starts to think about, I've grouped it as staff, as parents and children, and the premises. So those are all the things that you're going to have to address as you think about coming back. And on each of these checklists, there's room for you to put in things that are unique to your settings as well. But it's just to start to help you to focus as you think about reopening those doors. And alongside this, there will be risk assessment templates as well. And so, for example, I talked about the fact that how you group children and how you utilise the space available to you is going to be absolutely paramount, but it's going to be very unique to you. The risk assessment templates are going to address each of those areas, so maybe give you some things that you might want to think about, but also prompt you to think about what is relevant to your setting and add those things in. A risk assessment is unique to you. It's a process you go through. So I can give you the document, I can give you some of the headings, the rest of them you need to populate yourselves.
Thank you,
Okay. I think you were going to pick this one up, yes.
I was. Again, just thank you for that. What we've been able to do, hopefully, is to give you an overview of the guidance as it stands, and the consideration of the challenges we all face. We will go into more detail in subsequent resources, and I'll talk more about those in a second, particularly in terms of managing the environment as we welcome children back, and also then how you make sure that you're meeting the needs of children from day one. So more detail will be considered in those subsequent resources as well. Before we finish, just a couple of points. The guidance also makes reference to the potential for funding, because clearly the funding of educational circumstances is different from maintained schools, etc., where they're funded on places and we're funded on attendance, and that makes a fundamental difference. We do not intend to go into any great detail here, other than to say early years settings, the DSG, the dedicated school grant, is expected to be continued to be paid by local authorities for the provision of free entitlement. That will continue. As it has done over the seven week period. DfE and Treasury are working towards a transitional funding arrangement, and the Alliance has been invited to input into that and consideration of the parameters. But I don't have any date when that is due to emerge, but clearly that's something that, again, visiting our frequently asked questions page will be of use, because as soon as information is produced, we will try and give interpretations of that and make sure everybody has it as far as possible. So at that point there, we are continuing to work with the childcare sector to understand how it can best be supported to ensure that sufficient safe, etc. funding is available. That will be coming out in due course, but we are not in a position to address that in any more detail at this time. I've made reference to the additional resources that the Alliance is developing. There are 3 packs in the Welcome Back series. This one, which is supported by the webinar and gives an overview of the guidance as it currently stands. Then there are more details in terms of preparing your premises in the early years environment and meeting the needs for the children from day one. And we will be doing additional work for childminders and a webinar next week. More details to be followed. Melanie.
And Michael, we actually left a very important pack out as well that's already that's also available, which was that we did around the EYFS disapplications and modifications, which also includes some useful templates for working with reduced ratios and also a paediatric first aid risk assessment to actually help you to meet the revisions to paediatric first aid requirements.
Thank you. I had forgotten to put that on the slide. That is available on the Alliance's website as well.
It is. It is.
Also at this time, our online training modules with our partners at Educare are available. We've also done a specific bundle which is free to all providers during lockdown, which is around well-being during the lockdown period, and is an interesting point for practitioners and managers to share with their staff. We are also providing tailored information, advice and guidance for your particular settings through our Smart PD provision. Again, more details on the website. And possibly most important at all is the feedback which is invited from you at feedback@alliance.org.uk. This is a regular source available, submitting your questions, which hopefully we can answer, or at least if we can't answer them, we feed them into the DFE to get guidance on how we should respond. So whilst Melanie has quite rightly outlined the challenges and the sheer enormity of the range of issues that we all face here, hopefully you get a sense that this isn't being done, you're not left in isolation. You can seek support from our organisation when it's coming to turning your mind to what this all means for me and the children for whom I care. Just finding out more is the final slide. I think the final slide. We will make these slides available to those who are registered, as well as posting the recording on the YouTube site. Just to draw your attention there again to Connect events that we're hosting in different parts of the country online, which you can find further information through that link at development@eyalliance.org.uk. And then just the image of the packs to which I was referring earlier on. Melanie, is there anything else you would like to add before I close?
No, absolutely not. I think you've said it all really, Michael, that it's very challenging, but we're working with you.
Thank you very much. I hope you have found that overview and summary of the situation useful. As I say, it forms part of a series of resources, and hopefully we will support you going through as we move to the 1st of June and beyond, as we open back up the sector to care for the children who remain at the heart of what we do. Thank you, everybody, and thank you, Melanie.
Thank you.